Please start presentation.
Thank you very much again. So now I'm very happy to present part of the results of the subsequent project to the presentation before to you now, in which we have investigated the prognostic relevance of sequential plasma L-Lactate measurements in those calves. As already mentioned before, L-Lactate is a well-established prognostic biomarker as in humans and horses, and it's also elevated in calves with acute abdominal emergencies, but it's not possible to reliably predict the outcome based on a single preoperative measurement. But nevertheless, economical reasons and reasons of animal welfare lead to the necessity to predict the prognosis at an early stage of treatment. And L-Lactate has gained increased attention because of the availability and validation of cheap and portable L-Lactate analyzers, which make L-Lactate determination not only relevant for clinical settings anymore. Some studies in dogs with gastric dilatation volvulus, as well as in equine neonates or in feedlot steers with respiratory diseases, have shown that sequential measurements provide more accurate prognostic information than single measurements of L-Lactate. And therefore, the objective of this study was whether the sequential L-Lactate measurement provide a more useful prognostic tool to assess the prognosis of calves with acute abdominal emergencies. For the purpose of the study, a prospective study was conducted, and between August 2015 and December 2016, every calf up to an age of 7 months that was admitted to the clinic of ruminants because of an acute abdominal emergency of gastrointestinal reason was included, and if a thorough clinical examination has confirmed this diagnosis, surgical intervention was started. Therapy of those calves was standardized, and blood samples were taken out of a catheter at the jugular vein, and L-Lactate was determined on admission at the beginning of surgery and 6, 12, 24, 48, and 72 hours later. The responsible veterinarian was blinded to the postoperative L-Lactate concentrations, and decision for euthanasia was made by clinically experienced veterinarians, for example, in a setting, as you can see on this picture, where a partial aplasia coli was found in surgery. The outcome of the calves was determined over the study period until discharge and by a phone call to the farmer 3 months after discharge. So this is the same calf you see on these pictures. So let's come to the results. Total number of 84 calves could have been included to the study, and median age was 5.1 weeks. And 44 calves were female, 38 male, and 2 free martins were also included. And as in the presentation before, most calves were German Simmental. We have then grouped the diagnosis again under the affective part of the digestive apparatus. And as you can see, equal number of 15 calves had the apomasum and the small intestine affected. At the apomasum, more calves had a dilatation than a volvulus. At the small intestine, equal number of 4 calves had the volvulus and an intersusception. And at the large intestine, the partial aplasia coli, as I've mentioned before, was the most frequent diagnosis. The overall most frequent diagnosis was the generalized peritonitis again, but also the torsio-mesenterialis intestini. We found this in 16 calves, and the abdominal cavity was also very often affected in 24 calves. Now I have a flowchart for you again. This shows the outcome of the calves over the study period until discharge. You see that most of the calves, so 37, have died between admission and 6-hour samples, so in the time around surgery. And additional 8 calves have died after the study period was finished, so after 72-hour sample until discharge, which leads to a total number of calves of 24, which could have been discharged. This is a survival rate of 29%, which is close to the survival rate we found in the previous study. The survival rate until 3 months after surgery was 24% because additional 4 calves had died after discharge. And when I speak about survival and non-survival in the following slides, I mean as survival until 3 months after discharge. On this slide you see the L-Lactate concentration at respective sampling times. On the horizontal axis, the sampling times are presented, and on the vertical axis, the L-Lactate concentration. And as you can see, there's a significant differences in the L-Lactate concentration between the survivors, which are presented with these squares, to the non-survivors, which are presented with the circles, and to the non-survivors, which are presented in the squares. Except the 72-hour sample, we haven't found a significant difference there. These are the median L-Lactate concentration with according first and third quartiles again for the surviving and the non-surviving animals for each sampling time. And it's notable that median L-Lactate is never elevated above the physiological limit of 2.2 millimoles per liter in the surviving calves. We have then performed the binary logistic regression analysis for every sampling time. On this slide, I present to you the results of the sampling time admission, 6 and 12-hour sample. And as you can see on admission, odds ratio is 1.34. On 6 hours, it's already 1.69. And we found the highest odds ratio at 12 hours after surgery, which says that the odds for a negative outcome increase by a factor of 5.29 with every 1 millimole per liter increase in the L-Lactate concentration. We have also performed receiver operating characteristics analysis to test the diagnostic power. On admission, L-Lactate, the area under the curve is 0.79. At 6 hours after surgery, it's already 0.83, and the highest area under the curve was determined 12 hours after surgery with 0.91. On this slide, I've presented this rock analysis, and you can visually see how the area under the curve increases from admission to 6 and 12-hour sample. And through calculation of the Eugen index, we've calculated a cutoff of L-Lactate of 2.7 millimoles per liter, which has a sensitivity of 68 and a specificity of 100% for predicting non-survival in these calves. When we now come back to the question from the beginning, whether sequential L-Lactate measurement is a more useful prognostic tool to assess the prognosis of calves with acute abdominal emergencies, we can say yes. We've seen higher areas under the curve 12 hours after surgery, or 6 hours also. And therefore, we can conclude that a delayed normalization of L-Lactate in response to treatment is associated with an increased risk of mortality in calves with acute abdominal emergencies, and that the L-Lactate concentration determined 12 hours after surgical intervention appeared to have the highest predictive accuracy. We therefore think that the postoperative measurement of L-Lactate is a clinically useful tool to identify patients with a high mortality risk at an early stage after surgical intervention was carried out. Now, thank you very much for your attention again.